So this is case one. We call both of them refractory APC patients. Now, this is a 46-year-old woman. She's had persistent GAVE following APC at least 4 times at this hospital, and she's had low hemoglobin levels. Received 2 units of blood most recently prior to the treatments. She has underlying NASH cirrhosis. She has anemia, morbid obesity, hepatorenal syndrome. Her initial GAVE involvement was in the antrum, and when I was approached for treatment of this patient, she was in the hospital and she was so sick from her cirrhosis with pulmonary issues that she was not able to undergo anesthesia. So once she was optimized, I was finally able to do her initial treatment. So in initial treatment, she had confluent GAVE in the antrum, and her hemoglobin at that time was a little higher, 8.2. And then compare that to a year later when I finalized her last treatment with C2 CryoBalloon, where she only had small punctate spots in the antrum. And this hemoglobin was now 12. Of note, this is a patient that we submitted her video for FDA approval. So a very good success story. Now, I just said repeat EGD in 6 months for possible ablation, only as needed. She may never need me anymore. So overall, she's improved from her hemoglobin and she has not required any more blood transfusions. No adverse effects from treatment. These are her images of her initial endoscopy. What I would like to point out is that the gastric folds are very edematous, congested. You don't see any vasculature here. There's like this oozing red spot, another red spot here. It just looks, I would say, angry. This is after the first treatment we did. You're seeing some frost effect here, or bruising effect, I would say, before the frost, and then another area where there's some oozing after treatment. And this is the balloon fully inflating her stomach. Now compare this to her most final endoscopy on the 17th. This is the image that I'm showing you, and this is the balloon treating the areas. She received a total of 4 cryoballoon treatments up to this point, and these are the dates. And then again, her hemoglobin has improved, and she has not required any further blood transfusions since even prior to this endoscopy. And I just said arbitrarily repeat endoscopy in 6 months. Here is a video of her last treatment. So let me see if this is playing. So as you can see, we have this focal balloon. It's in the stomach, and only few punctate spots. Now I like to use the 6 o'clock or 5 o'clock position. Have the diffuser pointing towards the GAVE, and basically I'm rotating a little bit right and left to sort of be able to spread that cryogen onto the mucosa, and then balloon remains inflated, and then I wait for the frost to go away, and then I slowly turn to the other side, which is around the 9 o'clock, where I begin a few puffs just to double check, and then I complete at least a 14-second treatment. Now, overall, it looks significantly improved since her initial endoscopy. I'm going to show you this patient case because this patient had more than the 4 and 6 because of other reasons. So this is a 56-year-old woman. She's had persistent GAVE following APC treatments at least 6 times. Her hemoglobin level has been extremely low as 3.1 up to 7.3. She has received at least 13 units of blood transfusions, multiple admissions as well for anemia, symptomatic. So she's cirrhotic, she has anemia, and her initial GAVE upon evaluation showed severe red punctate spots, which I'll show you, and there are areas of oozing. Just looking at it, it was oozing. And her initial treatment was on the 12th of May of 2023, so almost about a year and some. We used C2 CryoBalloon. At that time, her hemoglobin was 4.6, and I believe she was as an inpatient, where the hepatologist asked me if I would just treat her with CryoBalloon instead of APC. And then fast forward a year later, we did another C2 CryoBalloon recently. She only had punctate areas of GAVE. Her hemoglobin has improved to 8.5. And I also don't think she needs another endoscopy for maybe another 6 months or as needed. So she's had an overall improved hemoglobin levels, her symptoms have improved, and we have not experienced any adverse events from her. So again, this is a refractory APC patient with the images. So she does have liver disease, and what I like to bring to your attention is that this is the top of the stomach. So this is the esophagus, this is the hycardia. You see these punctate red spots. So this patient has also gastropathy, which can be a confounding factor in patients with liver disease and also with GAVE. So this area can also bleed, but the etiology can be related to portal hypertension and not so much the GAVE etiology. And for that reason, it's sometimes hard to get these patients well treated and controlled for anemia because it could be multifactorial. And in her case, she's got portal hypertensive gastropathy with, these areas of oozing here, and you can see this mosaic pattern on a retroflex view of her stomach. And she has had required a lot of blood transfusions for that reason. So we have pretty aggressively treated her GAVE. Most recently, her hemoglobins have slowly creeped up 8.5, 10.2, and 11.1. But again, this can be related to gastropathy causing the low blood counts as well. But specifically speaking of her GAVE, this is the initial images of her GAVE. You can see what I referred to earlier. She's got these pretty significant red spots. Some of them look almost ulcerated, pretty punctate here, and some areas were actually oozing, a very congested mucosa. And these are some of the treatments with the balloon fully inflated, showing the areas of treatment. This is another area showing a circumferential treatment using 14-second applications. You're getting that nice beefy red in the stomach. And this is another image of post-treatment. You see that nice frost given that long seconds of treatment after withdrawing the balloon. And this is surprisingly more than a year later, you see this stomach almost looks like a normal stomach mucosa. I don't see any obvious punctate spots unless you look closely. So she received a total of 8 cryoballoon treatments, and her hemoglobins have now improved. I do have a video of her. This is a video of her from the initial treatments. This is, I think, July of 2023. Also, you see these, red spots here, and they look more angry. They're more red and congested. Same thing, balloon fully inflated, diffuser being applied to that area, and, finish almost 14 seconds in her as well, and then rotating it. Sometimes you do have to wait for that frost to go away on the catheter to be able to successfully turn it to the desired location. So that is for our last patient. And we wanted to sort of talk about a few tips and tricks for how to be more successful in treatment of GAVE. I think if you have a double channel or single channel therapeutic endoscope, it's going to make your work much easier because that air can be fully decompressed, and you can have nicer apposition between the balloon and the surface of the stomach mucosa. Now, 14-second application dosimetry has been used. I have used less than 14 due to different reasons, whether it was a little bit of pain or, post-procedure discomfort. But again, I try to stay to the 14-second application. We have used the focal balloon as well because you don't need a pear-shaped balloon because, once you decompress the stomach successfully, you can have nice coverage of that area. What I like to also do is put the tip of the catheter into the pylorus, barely into the duodenal bulb, and then inflate it right there. And that way you can nicely look at the entire antrum. And another thing I like to point out is I like to stick to one therapy possible because that way I'll know if there's improvement. Now, this last patient I showed you, she actually had one treatment of APC because I was away and no one wanted to do CryoBalloon. And so she got another round of APC in her initial treatments. But again, overall, I prefer to keep one modality throughout.